This is Dr.T.S.subashini from the Department of Pharmacology, SRM Dental College, Ramapuram. Today, we are going to see about common adverse drug reactions, particularly their manifestations in the oral cavity. Adverse drug reaction, according to WHO, is an appreciably harmful or unpleasant reaction resulting from an intervention related to the use of a medicinal product which predicts hazard from future administration and warrants prevention or specific treatment or alteration of a dosage regimen or withdrawal of the product. So, in general, adverse drug reaction refers to unwanted or unintended effect that is produced by a drug in its normal therapeutic dosage. In this video, we are going to concentrate more on the oral manifestations of the adverse drug reactions. Let us going to see the oral manifestations of adverse drug reactions. This slide shows gingival enlargement, or otherwise called as gingival hyperplasia. Drugs that can cause gingival hyperplasia commonly belongs to groups such as immunosuppressants and calcium channel blockers. So drugs like nifedipine, amlodipine, verapamil, diltiazem, they are all calcium channel blockers. And cyclophosphamide is an immunosuppressant and anti-cancer agent. And apart from this, phenytoin, an anti-epileptic drug, also can cause gingival hyperplasia. This slide shows xerostomia, the condition that occurs due to decrease in salivary secretion. Drugs like anticholinergic drugs, in particular anti-muscarinic group of drugs like atropine and first generation histamine H1 receptor blockers like phenyramine, chlorphenyramine, diphenhydramine, dimenhydrinate. These first generation H1 antihistaminic group of drugs are also having anti-muscarinic action, so they can also cause xerostomia. Apart from this, tricyclic antidepressant group of drugs can also cause xerostomia. This slide shows oral pigmentation. The usage of antiretroviral drugs like zidovudine and anti-cancer antibiotic like doxorubicin and one more anti-cancer drug like cyclophosphamide can cause oral pigmentation as an adverse drug reaction. This slide shows oral ulceration and drug-induced lichenoid reaction. So, oral ulceration, the causative agents are methotrexate, which is both anti-cancer as well as in low doses. It can also be used as an immunosuppressant in autoimmune diseases like psoriasis. Sirolimus, again an immunosuppressant, and NSAID pyroxicum. So these are the drugs that can cause oral ulceration. And apart from this, there are certain drugs that can also cause a lichenoid-like reaction. So in general, lichen planus is an autoimmune disease, but certain drugs can also induce lichenoid-like reaction. Rituximab, which is a monoclonal antibody, and glipizide, oral anti-diabetic drug, and hydrochlorothiazide, which is a thiazide diuretic, which is also used as an antihypertensive drug. Among the adverse drug reactions, coming to the oral manifestations, sometimes the hypersensitivity reaction that is produced by a drug can also tend to cause oral manifestations. Particularly this immune-mediated hypersensitivity reaction will tend to get angioedema. So drugs that are more notorious in causing hypersensitivity reactions like cotrimoxazole, beta-lactam antibiotics, ACE inhibitors and NSAIDs will tend to cause angioedema as an oral manifestation of hypersensitivity reaction. This slide shows one more hypersensitivity reaction, that is Stevens-Johnson syndrome. It is also a manifestation that occurs due to allergic reaction. So in Stevens-Johnson syndrome, the skin and mucous membrane will be affected to a greater extent. So too much of injury can occur to the skin and mucous membrane. Even severe blisters can also be seen. So drugs that causes this Stevens-Johnson syndrome are carbamazepine, lamotrigine. So this carbamazepine, lamotrigine are anti-epileptic drugs. And cotrimoxazole, which is a combination of trimethoprim and sulfamethoxazole, is an antibacterial drug. And nevirapine, antiretroviral drug. Apart from this, NSAIDs, particularly oxycap group of drugs, can also cause this Stevens-Johnson syndrome. Next is osteonecrosis of the jaw. For dental students, this adverse drug reaction is very, very important. This is actually a oral manifestation that is caused due to the usage of bisphosphonate group of drugs. So in the case of bisphosphonates, particularly this pamidronate and zoledronate can significantly cause this osteonecrosis of the jaw. These bisphosphonates are the drugs that are commonly used in the case of severe osteoporosis and hypercalcemia of malignancy. It will tend to produce so many adverse drug reactions, but the oral manifestation is osteonecrosis of the jaw. The pictures which I have shown here have been obtained from so many websites and significantly from the ResearchGate, BMJ and Open Dentistry Journal. There are so many other adverse drug reactions are also there. Those areas we'll see in my upcoming videos. Thank you.